I'll hand over to you.
Beautiful.
Thank you all. Thanks for coming.
Hello, everyone. My name is Louise. I'm the clinical nurse consultant and I work with the Aged Care Services Programme. I'm just going to share my first slide so that you can see our names on it. I'm also being accompanied at this session by Meg Jones. Meg, are you online? Do you want to say hello?
Yeah, good morning, afternoon, everybody. It's now after midday. I'm the Commonwealth Home Support Program Manager for the LHD, and I look after the program from a strategic point of view.
So today, as the first slide said, that we're going to talk about referral pathways and give you an overview of the My Aged Care supports, because I think within your field of work as practice nurses, you are seeing a lot of clients who may end up being referred to.
Lou, we lost you.
I got somebody muted me. So you guys see a lot of the people that we see for assessments. So you guys refer quite a few people, I think, to My Aged Care. So we're just going to go over what is My Aged Care and the referral pathways. So first of all, I'd just like to pause and acknowledge the traditional owners of the land in which we're meeting today, and celebrate their continuing connection to land, water, and community. I'd like to pay my respect to our elders, both past, present, and acknowledge the Aboriginal people of the nations that we have the privilege to live and work on. I'm on Wiradjuri country. I'm not sure if everybody is on Wiradjuri or on different lands, but I'd like to acknowledge the land that you are sitting on today. We celebrate and share the rich history of Aboriginal culture and recognise the diverse and proud Aboriginal nations across our district. And I apologise for the typo in that slide, which I've just seen. I will rectify that. So today we're going to talk about when to refer a client to My Aged Care, how to make a referral, what are the My Aged Care supports, and then we're going to talk a bit about the reforms. The reforms are very much driving our practice at the moment. We're working towards the new implementation of a new program on the 1st of July. I'm happy, Meg and myself are happy to take questions as we go along. If we don't see your hand up, just come off mute and interrupt us. We are not very precious. Meg and myself bounce off each other, so if I forget something, Meg always jumps in and saves me, which I'm very grateful for. So first of all, I suppose the question is, when do you refer somebody to My Aged Care? We get a lot of referrals for people who want to go on a wait list, or they want to be registered just in case. According to My Aged Care, the criteria for somebody to be referred for a My Aged Care assessment is they need to be over the age of 65, or they need to be over the age of 50 if they identify as Aboriginal or Torres Strait Islander. And the other caveat is that they need some support to remain in the community. So if they're 100% independent, they do not need to be referred for a My Aged Care assessment, because we're not going to have any services to offer them. If they require short-term care, so short-term care could be in the form of short-term restorative care, which we'll go into later on, which is that wonderful community restorative care program that helps reverse loss of function in an older person. If they need short-term respite care, so if their caregiver is going into hospital or going away on a wonderful holiday and don't want to leave mum or dad alone at home, they can be referred over for approval for respite care. Or if they're ready to move into an aged care home. And when we say ready, we're talking about in the next 6 to 12 months, not in the next 3 to 4 years, in the next 6 to 12 months. We understand every care home have their own business rules and they have their wait lists. So we don't knock people back who want to go on a wait list. We just do the assessment, make sure they're eligible for the support they require, and then they go forth and be on a wait list at their own leisure. Aged care services are not a substitute to early intervention. So you can imagine aged care services are limited on what they can actually do to support an older person. So there's very much other programs that are available to us in the community, such as early intervention, rehab, subacute programs, healthy lifestyles programs that are much more appropriate for some people as they're aging, because by the time they get to us, they need supports. So it is that long-term support. Just finding my cursor. So you guys have, I think, various ways of referring somebody to My Aged Care. And when I was looking at the PHN website, there were links to My Aged Care, and I believe within some of your software programs, you can refer to My Aged Care. Is that right? No, I must be completely wrong. So the traditional way of referring somebody to My Aged Care is through the myagedcare.gov.au website. Um, the internet is the easiest way for you to support somebody to pop a referral into My Aged Care. The telephone is absolutely horrific because you'll sit on a queue for 45 minutes and you need to have the client with you so that they can talk. You can talk on their behalf. So we always find that the e-referral is a much better way of sending a referral through. You need your client's consent in order to make a referral. You can't just refer somebody over because you think they need supports. You need their consent to pop this referral in, because then they'll get a phone call either from My Aged Care or from an assessment organisation in the area where they live to ask them, I'm ringing you because you've been referred over an assessment. If they have no idea, it's actually quite disconcerting for them and the person speaking to them. As I said, you can call the My Aged Care Contact Centre, and that's the number. That is an Australia-wide number, so I don't know where they sit. I think they sit on Mars, but they are scattered all over Australia. You need to have the client present with you for this, and as I said, the wait times could be quite extensive. You could be put on hold for quite a long time. That's what we are hearing from clients who speak to us about the 1-800 number. If your client is deaf, this is a very challenging way of getting referral done, because even though you will say to the contact center, the client is deaf, they cannot hear you, they will insist on speaking to the client and hearing the client's voice. So that's just a tip that I found out a few weeks ago. Apparently the GPs can make a GP e-referral, and that's through their software programs that's available within the GP practice. And that will come through electronically through to My Aged Care, and then it will be sent out to the relevant assessment organisation to be managed. So at the moment, there's not a lot of transparency in the community about what services a client may already be accessing. I'm just going to go on mute to cough for a moment, pardon me. So it's up to the client to be able to articulate to you what services they've got. And a lot of people think they're on home care packages when they are actually not on home care packages. So to find out what services a client has, it is that dreaded 1-800 number and having the client with you. As assessors, we are encouraging family members and clients to set up electronic My Aged Care records so they can go in electronically and see what they're approved for. So if your client has access to that, then that's an easy way of finding out what they're approved for. You have to have your client's consent to receive anything. So that's why you need your client with you to give consent to the My Aged Care Contact Centre to release that information to you. So it's always best to try and get the client to tell you what they have got referrals for or what services they got in place. Once you've registered with My Aged Care, the client can receive a multitude of information. The My Aged Care website has a lot of information, booklets, resources that can be downloaded, printed and given to clients, or they can access electronically if they're savvy enough. Some of those resources are how to access aged care services, what is a home care package, what is the Commonwealth Home Support Programme, and they are printed in large print with very minimal amount of texting, except for the one about moving into an aged care home. And they do give quite a lot of information for clients in an easy to read manner. So there are various supports that clients can access through My Aged Care. The most common one is the Commonwealth Home Support Programme, and that's for entry-level supports, and Meg will talk about that in the next slide, I believe. But that's single services to keep a person supported at home. They may need help with domestic, they may need help with shopping, they may need help with meals, they may need help with personal care. So it's not very intensive support, it's just very low level. The next type of support is a home care package. Now, a home care package at the moment will be approved under the Aged Care Act, so it's got very strict eligibility criteria of who's eligible for a home care package. This is for people who are living with complex care needs. So they may not be able to manage their own affairs in contacting people to come in and help them in the home. They may have issues with understanding the system, whether it be down to a cognitive issue or just not being able to navigate my aged care. At the moment, home care packages are sitting from level 1, which is low level, up to level 4, which is the highest level that somebody can get to, and those care needs are quite complex. There will be changes to those levels of home care packages once the reforms have been put in place come 1 July. The other program under the Aged Care Act is flexible care. So I'm not sure if any of you have heard of the transitional care program or the transitional aged care program. This is a 12-week program that a client may be eligible for when they're leaving hospital. So if they've been in hospital for a hip or a knee replacement and they just need that ongoing allied health support and some low-level non-clinical support to get them home, that is something that you could talk to your clients about if they're going in for surgery. Go and think about asking for a transitional aged care program. If somebody's going to a metro base to have an operation, they can have an assessment in the metro base metro area for that program as well. They don't need to be in Western New South Wales LHD to have that assessment done. The other program under flexible care is called short-term restorative care. I really love this program. This is a community-based 8-week program, and the aim of that program is to slow down or reverse functional decline, and we'll go into that a little bit later in the slides. And then the last one is residential care. So we love when we see clients starting off in the Commonwealth Home Support Program. They may then do a short-term restorative care program. They may then go on to a home care package. They may pop into hospital and be in TACP. They may have another assessment to go up to a higher level package. And then towards the end of their days, they end up in residential care. That's the ideal journey for a client. Doesn't always work out. So Meg, I think I'm popping over to you now for this one, am I?
Yes, thank you, Lou. Thank you, everyone. And I did hear, like, you call me Meg George, and that's fine. That's my maiden name. So obviously, someone knows me from quite a while ago, but I go as Meg Jones at the moment. So the Commonwealth Home Support Program, as Lou has already mentioned, it's a suite of supports that assist people still living in the community. And by the community, it doesn't mean that they need to be living in their own home or renting a place, as long as they're not in a facility or a building that is being supported through other government funds, like a hostel or a residential aged care facility or a hospital. They can be classed as living in the community. That also includes homeless people as well. The low-level support can be short-term or long-term. The model of care that all the Commonwealth services run under is a wellness and reablement model, which is very similar to like person-centered care, which as health professionals we've been using for a very long time. It's probably just one step closer to client-directed care, like the NDIS program model of care. So the easiest way to describe it is doing it with a client rather than doing it for a client. So it's sort of like engaging with the client, looking at what their specific goals are, as opposed to us saying that we're going to come in 3 times a week and do, like if you're a community nurse, do a dressing. It's more like, what is the client's goal from having that sort of intervention, and working with them to achieve that goal rather than having a clinical focus. The services that we have across the LHD include clinical services, community-based nursing, allied health services. For our LHD, the majority of our Commonwealth Home Support Program services are occupational therapy, although we are morphing that into some of the other allied health streams disciplines at the moment. So physiotherapy, social work, dietetics, those sorts of services. We have quite a few non-clinical based services as well that we run throughout the LHD. Most of those are social engagement programs like social support group, which is also known as daycare, or wellness groups, or integrated living groups. We also have community-based respite. That the community-based respite that we have, unfortunately, is only in Gilgandra, and we have community-based respite in Narromine, which is in-home respite. So where our workers from the community go into the client's home during the day, it's not overnight, and they will stay with the client while their carer goes and has a haircut, goes to work, whatever they need to sort of like get, a break from their caring role. We also have Meals on Wheels services. We've got two Meals on Wheels programs across the LHD. That's in Brewarrina and Collarenebri. They're legacy systems that we've held for quite a while, and we provide those services because there's no alternative in those areas. We also have some dementia services. They actually fit under other service types, is what the Commonwealth call them, within the LHD. So we have dementia advisory services based in Dubbo, Parkes and Bathurst. And we also have a dementia counselling team based in Dubbo, but they cover like the 10 LGAs around Dubbo and going up into that northern upper western type sector. But these other services that are on this slide we don't provide, but CHSP providers do domestic assistance, transport, home modification, personal care. So there's quite a raft of different services. There's also a service called Social Support Individual, which is I haven't written it there and I apologise, but it's a very broad service type that can include a variety of low-key home maintenance types services. So if someone is staying at home but they can't change a light bulb, or they might have their winter clothes stored in a suitcase somewhere, they can come and help them sort that out. They can take them shopping, they can take them to doctor's appointments. It's not a transport specific program, but they can do those sorts of services. It could even be sort of like a social engagement type situation where they just ring the client once a week or twice a week, just so that they've got some contact with other people. It really is based, like I said, it's quite a generic program and very tailored to the individual client and also what that service provider provides. Most CHSP service include some sort of client contribution, a fee. The two exceptions that will always is now and always will be free are the community nursing and the allied health services as a clinical service. Just for your knowledge, New South Wales Health, for all our CHSP services, do not charge a client fee, except for Meals on Wheels, where we get a small contribution towards the cost of the meal itself. Are there any questions about like the program or what it provides? Nope. Thanks, Sue.
Meg. So now I'm going to go into home care packages. As I said, the home care packages range from level 1, which is low level support, right up to level 4, which is intensive, complex, high level support. A home care package offers a client case management care coordination. So what that means in layman's terms is that's a one-stop shop for all of your services. You only ring one telephone number to contact your case manager to organise the supports for you. Also, if somebody rings in sick who's scheduled to come to do your cleaning or your showering that day, it's the responsibility of the home care package provider to replace that person so that you can have that service on that day or another day if the roster did not allow flexibility within the day. day of the sick leave. All home care packages are means tested. At the moment, a lot of providers do not means test anybody who's on a Centrelink pension or the aged care pension. They just do not charge them. But if you're a self-funded retiree, you need to do an asset and income test prior to you starting your home care package, because then you'll pay a client contribution to the cost of your package. There are extensive wait times for our home care packages. We're up to 9 or 12 plus months now for the higher level 3-4 packages. Our level 2 packages, it's about a 6 to 9 month wait, and the level 1 packages is about a 3 to 6 month wait. We've got no control as assessors over the wait time. This is purely to deal with the fact of supply and demand. The Commonwealth have only released a certain amount of packages across all level 1, 2, 3, 4. And in order for somebody to be assigned a package, they need to move up the queue. And to move up the queue, either somebody moves on to a different level package, or they move into care, or they pass away. So it's not a finite budget available for these packages. Once a client is approved for a home care package, even if they have no intention of ever taking it up, they are no longer allowed to access New South Wales Enable. So Enable is that another bucket of money that's available for somebody to buy equipment or prosthesis for them to continue living independently at home for as long as possible. So if your client has a disability, or need oxygen, I would not be pushing very quickly for them to be assessed for a home care package, because New South Wales Enable need to be mobilised to help purchase equipment for them prior to coming over for a package. If your client is approved for a home care package and they need equipment, they need to save that money up through their package. So that may mean going without services so they can bank the money, or waiting a good 6 months before the money has been accumulated in their package for them to buy that piece of equipment. The aim of a home care package is to keep somebody at home. That's basically what it is. If we go into the flexible care, so this is the transitional aged care program. As I said, it's an 8 to 12 week program. It's got an amazing wellness and reablement focus. It's all about restoring somebody's wellness and function in order for them to remain at home with the minimum amount of supports that they will require following discharge from a hospital. It provides the 9 core services types to optimize functioning. So what the 9 core services are, it's the whole 9 allied health services that are available to anybody. So you've got your OT, physio, dietitian, community nursing, and social work. So if the client needs any of those allied health supports, they can access it through the transitional aged care program. And then they can have clinical support as well. So if they need short-term support with shopping or showering when they're recovering from their transition home from hospital, they can access it then. The aim is to prevent premature admission to a residential care home. And the other underlying one is trying to stop the person from representing to hospital. And a client can access the transitional aged care program either in the community for the entire time, or they can go into one of those 3 residential care homes who offer residential TACP within West New South Wales LHD. They can go in there, or they can have a mixture of both. So they could start from residential and then they can move home. I believe they've reduced the cost for going into residential TACP to the client, because that was quite prohibitive for a lot of people. And at the moment, West New South Wales LHD, who are a provider for the transitional aged care program, do not charge any clients for this program. But the idea is that they need to be in hospital, ready to go home, and they have an assessment. So once again, it's those clients who are planning to have a planned operation or hip, knee, shoulder. You can talk to them. Hey, when you're in the hospital, maybe talk as a discharge planner about the transitional aged care program. As I said, this is my favorite one, the short-term restorative care program. I just love it. It's that 8-week community-based program, and it's really just to try and stop or slow down a functional decline. So if you've got a client or a patient who comes in and they're just starting to have falls, or their mood is starting to change, and you've put in what intervention is available in the community, you may consider referring them to My Aged Care to see are they eligible for the short-term restorative care program. I think we've got 3 providers in West New South Wales LHD who offer this program. They've got 6 months from the day that this person's been approved for this program to actually do the program. So there are wait times, but it's well worth it for clients. They do benefit very well from it. We're seeing a lot of people who are living with early stage, like mild cognitive decline or early stage dementia, benefit from a short-term restorative care intervention just to help them understand the disease, connect socially, and make sure the family understand what's going on as well. If you are approved for a home care package, you cannot use short-term restorative care. It's one of the rules that the Commonwealth have come up with, so we just have to roll with it. And then the last thing is respite care and residential care. I think they kind of speak for themselves. Respite care is that if they need a break from their usual caring arrangements, their carer is going away, their carer is unwell, people can access respite care. And then if somebody wants to move into care permanently, they can seek approval for permanent care under the Aged Care Act. Any questions so far before I get stuck into the reforms? No. We as assessors are currently working under the Aged Care Act 1997. Following the Royal Commission with its 136 recommendations, I think, for aged care, one of the first things they had to do was change the Aged Care Act. The current act that I'm working under is not a rights-based act. It's very much about providers, that providers have all of the power, and then the client is kind of spoken about towards the end of everything, whereas the new Aged Care Act 2024, which is going to be put in place on the 1st of July 2025, is very much keeping the client at the centre of the act, and it is very centre focused and rights focused. The way my aged care assessments are conducted now has changed. There's a new assessment tool, and there's an algorithm built into it which has not been switched on yet, where we expect that that algorithm will guide the assessor on what the client is eligible for. There'll be new aged care quality standards, so any provider who provides support under the Commonwealth will need to comply with the new aged care quality standards from 1 July 2025. Lots happening on 1 July 2025. We, as assessors, began the new single assessment workforce on the 6th of December 2024. So we no longer sit as ACAT and RAS. They were the old names. We now sit as the single assessment workforce, and we do comprehensive assessments or we do home support assessments. And our titles have gone from ACAT, we're now called clinical needs assessor, and the RAS are now called non-clinical needs assessor because the Commonwealth like their jargon, but we'll just go with it. The Support at Home programme will replace home care packages and short-term restorative care from 1 July 2025. I believe there are going to be 8 levels of packages available to support somebody at home. And Meg, is the range of money I think goes from $11,000 to $78,000 per financial year.
Yes.
Home mods and assistive technology are going to step out of home care packages. At the moment, if you're on a home care package and you need home modifications, you need to bank the money up in your package to pay for those supports. And you can imagine if you're doing a bathroom, that's going to take a long time for you to bank that money up. So the Commonwealth have decided that home mods and assistive technology will sit outside on its own so that it's more equitable access for everybody to have modifications or assistive technology implemented into their home. If you're waiting 3 years to see an occupational therapist to have a home modification done to your bathroom, more than likely you're going to end up in care before you see that occupational therapist. So I'm quite excited to see how this is going to pan out from 1 July 2025. And then 1 July 2027, CHSP will no longer exist. It's going to look different. It'll be absolved into the Support at Home programme. And Meg, is it from 1 July 2025 CHSP will come under the Aged Care Act?
That's correct. Yep.
So
from the 1st of July, we go under the Act like all Commonwealth services.
So it's a wild ride as assessors, and for Meg, who's the manager for CHSP for the LHD, we're just going with the flow and seeing what it'll bring us. And West New South Wales LHD are no longer the only assessment organisation in the marketplace. We have retained 100% market share of hospital assessments because that makes sense we are working with health, we've got access to the health records, so it's easy for us to do hospital assessments. But there's other assessment organisations doing my aged care assessments for supports at home or for moving into care, and there's other assessment organisations also for doing the assessments for residential funding for somebody who's living in a care home. So that's just a quick touch base on the reforms. That's the end of our presentation. I'm happy to take questions if anybody has any at the moment. Did we hit the brief? Because we were trying to plan this and we were hoping that we were hitting what you guys wanted. And if we haven't, please give us the feedback, because then we can go back and make sure that we do a presentation that does hit what you are wanting and what you need to know.